Thank you so much. This is always special for me. The film was premiered in January of this year, and I've had the beautiful opportunity of attending some of these screenings, and it's always so moving and touching to watch the film with the audience and to really hear your impressions. This was 4 years of our lives that we dedicated to the making of this film. Never did I think that I would someday make a film as a physician, but life circumstances put you in a place where you felt compelled to share what I had learned, not only as a physician, but also as a patient, and the suffering that I experienced, and knowing that there's so much power in our decisions. And I'm grateful to Marcia Machado, who is the filmmaker behind Code Blue, who approached me back in 2015 and said, had heard about my story and as a documentarian wanted to share the story, but I said to her, the story is really not the important part. It's really the big picture, what we're doing in healthcare and how might we change our approach to clinical medicine in our country. And that's really the story that I wanted to tell. It wasn't just conveying the importance of our lifestyle choices and the power that lies behind them, but also this idea, the absurd fact that physicians don't learn this in medical school, that we're so ill-equipped to convey this message that is so powerful to our patients. And so it is my hope that we not only empower patients to make better decisions for themselves, to allow for better health outcomes, to improve the quality of life of each and every one of us. My dream is for each one of us to live a long and healthy life, and at age 95, go to bed after enjoying a day with our family and friends that we love. We fall asleep and then we don't wake up. That's the ideal ending to our lives, not what I saw in clinical medicine over 20 years, where I would see so many, that bookend of suffering in a nursing home wearing a diaper and status post-stroke and dementia. And there's great sadness in that, not only for the patient, but for the family that suffers as they witness that. I hope that the film catalyzes a discussion amongst those that create curricula in medical schools and nursing schools, anybody who's involved in the healthcare experience, that we create healthcare professionals that can speak to the power of lifestyle. And of course, the medicines that we've developed and all the amazing advances that we have in clinical medicine are important too. But when we know that 80% of the chronic diseases that we see in clinical practice today are preventable, we should be screaming that from mountaintops, and we should be assuring that every one of us understands the importance that lies in those decisions that we make. What are we putting on our plate? Are we moving every day? Are we managing the stress in our lives? Because they're so critically important in the quality of our lives. Dr. Negrón, I'm so blessed to be here with her. I met Dr. Negrón in 2015 and immediately knew she was amazing. And she was one of the, and in fact, as I thought about who I wanted to be in the film, she was one of the first individuals that I asked, because I thought it was so important, and to witness what she's doing here in Phoenixville and how she's affected her community, I think is amazing. And I wanted the world to know about Dr. Negrón, so I'm so blessed to be here today with her. And please say something.
I never thought I would be in a documentary. I'm privileged to be here, and I don't want to really take up too much time talking about myself, but I will echo some of the words that students mentioned. We come into medicine thinking that we are going to be, that life and the way we live and that nutrition is important. And you saw that 74% of students think that way, and they come out of medical school having that washed out of them, because there is something else that replaces that initial energy that brings us to. In fact, I was never given a healthy patient and charged in keeping them healthy for 4 years. I always met sick patients. I never knew health. through medical school. So we really, the call in this documentary is for us to really think how we have allowed ourselves to forget what health is and how to support health. And wouldn't you want to have your physician take time to talk to you about how lifestyle choices and your diet has really brought you to where you are and how it can really take you out of where you are, doing the reverse. Yes, what I've been doing is cooking with my patients for the last 15 years. I also never thought I would be cooking with my patients. When I changed my diet 30 years ago, it was for ethical reasons. It had nothing to do with what I had learned in medicine. Then I met so many other people and information that from science and medicine that had been kept away from me, that I emboldened myself, took a 2-year sabbatical, learned about nutrition and medicine, and then brought it back to patients. And many of you already know the story. So I am incredibly grateful to be a part of this and to have had really to learn nothing more esoteric than to really eat well and move and love. And be in community. These are things that are really within our grasp. And how have we allowed to have that washed out of students that come into medicine to really help us be healthy? That's beyond us.
I think the goal is to change culture, and in order to do that, we have to do it together. That's why these community gatherings are so powerful. I know there's a lot of wonderful people in this room who want to do something in their own town, in their own community, in their library, in their school, share this message, and I think we need to do that. We all have a responsibility to do that, and it's really a partnership between healthcare professionals and community so that we can create, I think, like sweeping change across our culture. We have the 4th of July coming up next month, I guess. And on the 4th of July, we celebrate this country's birth by grilling hot dogs. And then we feed them to our 4-year-olds. And the World Health Organization tells us that these processed meats, these hot dogs, are carcinogens. And yet it's the American way to grill a hot dog and feed it to our children. We need to change that. These are, when we know better, we do better. The data is overwhelming, so let's make these changes. We can do them in our home. We can share them with our family and friends. And little by little, we're gonna change culture, but we have to do this together as a community.
Imagine that the children choosing schools for their future education ask not just the dorms and whatever questions the students ask, but really, is there a lifestyle track? What kind of support do I get as a student, to practice a healthy lifestyle? When the students are asking that of their prospective schools, colleges, medical schools, they take notice because they're in competition for the students, the best students to come to their schools. So that's how you start to, a groundswell of demand for the product that's going to be sold to them. And then, of course, the test exams will have to reflect that, not just in early education, but in colleges and in medical schools and throughout our careers in our specialty test exams. Right now, how many test exams have anything to do with food and lifestyle? The residents were proudly telling me that they had 5. And all the rest are...
That many?
That many. And all the rest are, the 20 medications that we can juggle to lower the blood pressure of someone, when we could do that with a change in their lifestyle and their nutrition much easier, with less side effects, less costly, with the patient not really being burdened with the diagnosis of patient for the rest of their lives. The implications of really the kind of medicine that we have created are huge. So again, it's really are there any high school students here? Are there any college students here? Right. Are there any medical students here?
No medical students. All right.
Nursing students.
Excellent.
I was going to ask, allied health professionals, students or professionals. Yes, teachers, elementary school teachers, middle school teachers. So, the conversation starts anywhere.
Yeah.
I mean, community people, leaders in the community. I know there are many community leaders here. And it crosses, look around us. I mean, who is getting sick is not just a group of people. It's wealthy, it's educated, it's CEOs, it's physicians, it's nurses, because we are all surrounded by an environment that really, who wins? How can we win? And you meet a machine with a movement. These are the words of Alexandria Ocasio-Cortez.
I'm happy to take questions.
I was just curious whether or not the insurance industry is looking at this lifestyle medicine more and more and incorporating it into, what they're covering, because it seems like a no-brainer. They're looking for cost savings, and this is.
That's a very convoluted question. Now everybody heard it, right? We all have our individual answers. Right now we have a very lucrative system that rewards the more procedures, the more testing, the more everything we do, the more is paid back. We have to change wherever you are. If you are part of anybody here from the medical insurance world, anybody here who is paying for insurance, we need to really change it wherever you are. But thinking that it's going to change from the top to the bottom is not going to happen. It's yes, maybe some of the top will make some changes, but it will be as a result of pressure from below and from all sides. It's by you saying, I want to go to a dietitian that talks to me about whole foods, plant-based diet, not a dietitian that will teach me how to make chicken healthier or to make, hot dogs healthier. That's not what we want. So it's got to be pressure from everybody.
I became a nurse in 1970, and I could not possibly agree with you more, truly.
Great.
My grandmother died in the late 1970s. She was 97 years old. She raised 13 children with no antibiotics, no anything. And she totally lived your lifestyle just because that's all there was. And when she passed away, they wanted to do a post-mortem. They said, we don't know why she died. And I told my mother, you did tell them she was 97, right? I mean, there comes a point when, and up to the day she died, she was healthy, she was clear, she was active, and it's just because of exactly what you're saying, and I could not agree with you ladies more.
Thank you so much. I mean, it's pretty simple. It's a pretty simple prescriptive. It's really, you don't have to read 10 books to figure this out. It's, eat primarily plants, move every day and manage your stress. And, alcohol is obviously an issue. Sleep is important. These are all, pretty basic things. But when we address them, there's magic.
If you know of the blue zones of the world, some of the people who've been interviewed say, in response to the question, how come you lived so long? We forgot to die.
I like that.
And one of the things that I borrowed from these communities is, let's make our own blue zones
Yes.
for us to move around with. I walk in my own blue zone. I move, I love, I eat well, I exercise, I try to reduce stress, I get together with really fun people. So if many of us are walking about like that, these little points, blue zones coalesce.
I just wanted to get back to the insurance question. The reason why insurance companies don't get involved with these types of things is because, let's say today you're a member with Aetna, and they promote what you're talking about, your healthy eating. Well, next year, you may be with Blue Cross because it's so price sensitive. In other words, you're going to be helping the competitor.
I see.
And so because you partake of your wellness program and your costs go down, with, let's say your illness costs go down, well, you're helping the competitor.
That's interesting.
That's what happens.
Well, what about collaboration?
Yeah. Maybe, yeah, it's a problem. The system needs to be fixed.
Oh, hi. So you spoke of community, so I'm interested in what community is available and how one gets connected.
Well, community, one place where there's community happening every week in Phoenixville is at Alianzas, which is the hub of people who need something or have something to give, and they get together, and our director, Nina Guzman, is here. And that's where we cook every week. Alianzas is on Church Street, right in front of the clinic. It's 148 Church Street. Tuesdays, 1 o'clock, show up. We're cooking every Tuesday, 1 to 2:30.
Getting back to the insurance, a lot of insurance companies, they will cover alternative treatments and alternative like prescription type things like acupuncture and things like that, only after other things have not worked for the patient. So for example, an addict who has been to treatment centers that were covered by insurance now wants to try a doctor who's doing some like a lifestyle type regimen, and they're trying to get it accepted by the insurance. And the reason why they're being considered is because they have tried so many other things. And I think that goes for a lot of conditions in general. It's like you can kind of petition your insurance company and fight for yourself to get certain things covered, and they will consider it if you have failed other avenues of conventional
I don't
healthcare.
consider what I do alternative.
No, but they do. But I'm talking about just in general, like other, not necessarily like a lifestyle, plant-based kind of eating, but like other therapies that include that kind of holistic approach is what I was thinking, because she was wondering why insurance companies aren't so quick to pick up, say, an alternative type of doctor, someone who promotes lifestyle changes and stuff like that. A lot of those are not covered by certain insurances, and they are expensive. And so if it's, you just kind of have to fight with the insurance company. I don't know.
I want to echo what Dr. Stancic just said. This is not alternative. This is the core of medicine. Medicine has really gone astray. Medicine is using prescription medications and procedures as the way, when that really should be when everything else fails, or to save somebody's life. We're talking about physicians, and the medical industry adopting a lifestyle practice, which includes all the education that medical students get to become this lifestyle medicine physician, and nurses, etc.
Yeah, this should be the standard of care. In our country, diabetes is exploding. Right, when I was in medical school 25 years ago, rates of diabetes 2% in our country. Today, we are brushing past 10%, and the CDC ominously predicts that by 2050, by the time my son is my age, more than 30% of us will be diabetic. And yet, the scientific literature tells us, one of the studies we we speak to in the film, the Potsdam study, tells us that by modifying our behaviors, we can prevent 93% of diabetes. 93%. And yet it is growing exponentially in our country. This is not alternative medicine. This is just, we need to return to our roots and speak to the power that lies, who's the nurse in the back, that your 97-year-old grandmother, the lifestyle that she lived, critically important.
Regarding the finances, we're spending $3 trillion a year on the management of chronic illnesses. This is not something that alternative medicine can treat. Heart disease, or heart attacks, which is the #1 killer, that's not going to be treated by alternative medicine. This is the core of medicine, the addressing the risk factors of hypertension, high cholesterol. This is medicine. I want us to really start thinking that we cannot fix this by just little tweaks. This has to be a sea change.
I have more than a question. There is a very thankful to Dr. Ana Negrón and also to Alianzas to open the doors to this program, because I'm an indigenous person from Mexico, and 7 months ago, with a full symptoms of pain, stress, being really fat person, I lost 31 pounds. But the most I am doing is be healthy, and I'm very thankful to Dr. Negrón, because I say too many times to her, like, she gave me my life again, and there is a wonderful thing. Thank you, Dr.
I'm just wondering, how do physicians, people in the medical profession can they watch this film through another method besides, going to a screening like this? And would it be appropriate I have an internist who I love, from a medical profession, could I suggest that she watch this?
Oh, I hope you would. That would be great.
I didn't know if that would be insulting to her.
Yeah.
But
Oh, I
she's a
hope
wonderful
not.
physician, and I would love her. I know she's not plant-based experience,
But that's
obviously,
okay.
even more
I mean,
now.
We could introduce
Yeah.
the idea. I mean, my hope is that one of my goals, there's 179 medical schools in the country. I'd like to screen it in every one of them. And certainly over the next couple of months, we're sort of finalizing distribution plans, and the film will be available hopefully in theaters, and it'll be available on I don't know, Netflix if that's possible, or you can go to our website and download it or share it and give it to your friends. And I mean, we want, our goal is to disperse the message far and wide, because it's of course not just our country, it's a global issue. So I want doctors in England to speak to the power of lifestyle medicine, and Australia and China. We want this to be, I think if we all spoke to this ubiquitously and universally, we could change the tide of this chronic disease epidemic. But again, we all have to do this together.
Remember, you meet a machine with a movement.
I'm a nurse, and I found the movie to be very inspiring.
Thank you.
Something I do see happening, and it's been happening, is that people don't like to take ownership of or any responsibility. And we grew up in a society, I mean, people my age and older, where there's a pill for everything, and they're always looking for the easy way out, and they're just, can't the doc prescribe an antibiotic for this? Can't they prescribe a pill for that? They don't really care that they're on like 50 different pills. And it's a shame. It's just like, if we could, the movie, like I said, if you could get this out there mainstream so that more people could watch it and try to take ownership of what's going on with their bodies. And I think it would be extremely helpful.
Thank you. Well, that's the hope. And it's really about, again, changing culture so that what is considered, routine, that the way we think, our perspective. I hear this all the time and from patients, they'll say to me, Dr. Stancic, I have high blood pressure because it's genetic. right? My father had high blood pressure. His father had high blood pressure, so it's genetic. Or my cholesterol is elevated. It's genetic. I mean, there is obviously familial hypercholesterolemia, but that's a sliver, right? Or my father had diabetes, so of course I'm going to get diabetes. And of course, that was the point of adding the topic of epigenetics, that we are not defined by our genes, that yes, genes play a role, but do not kid yourself. Lifestyle matters most. And I hope that's exciting to everyone, that empowers us to make decisions. That's what I want. When we just sort of lay back and just take one prescription after another, which is the typical thing. I think the average 60-year-old in our country has, I don't know, 4 or 5 prescriptions, and this is considered normal. We need to change those norms and redefine moving forward what the American lifestyle is going to be, and because we also set the example, I think, for many countries across the world.
The psychological fields have contributed to us, at least in how we change. And to your question, that a lot of people don't want to do. There's 20% of the people that are ahead of the curve and really moving fast, and they are the people who I look up to and who I am really running fast to catch up with. And then there's the 20% of people that are entrenched and that they really are not going to move no matter how much you drag them, no matter how many documentaries you show them. And then there's the 60% of people who are either closer to the movement or closer to the status quo. And those are the people who we really can sway. Those are the people who are going to move the movement. Those are the people who will say, well, gee, how many people do I get in the office, who, because I ask the question, they open up. Well, what about helping people ask the question and then having physicians, answer the questions? But we can all be patients and physicians to each other. Healthcare is not what we think. What we think as healthcare is actually sick care. That's what we spend the $3 trillion on. Healthcare is what we do every day. Healthcare is how we move, how we eat, the choices we make. So that's really social fabric. That's the social fabric of our lives. And the 60% of people that can be swayed in one way or another, we're in contact with them every day. We go to work with them. We see them in restaurants. They're family members, they're new friends. So I want us to leave this theater, not yet, but thinking how each of us can really start making the move towards having a redefinition of the medical practice. But it starts with, medical practice, medical education, students applying to medical school, families having conversations, communities making space for healthy lifestyle.
Yeah. There's a wonderful quote by Gandhi. I'm sure you're all familiar with it. Be the change you want to see in the world. But, we need to be the example.
So if you're not willing to make to do the work, look for somebody who could do the work.
I have a question about the science behind the nutrition part. I'm familiar with some of the studies that were presented in the film from Edelstein and some others about plant-based eating. I'm also familiar with some studies saying that it's not the fats in meat, but rather the carbohydrates and the sugar in processed food, which causes inflammation and leads to many of the disease conditions that we see so prevalent in our communities today. Do you have an opinion on this second school of thought?
Yes, my opinion is, wouldn't you like to be able to have these conversations with your physician and have an intelligent conversation with your physician who can provide you references and studies and who can really intelligently guide you through this? I think that's really what this documentary is about. The individual questions, legitimate as they are, have to be broached with people who are prepared to do that. And right now, we're talking about opinions. that float around, and people who are doing things not within the patient-doctor relationship or patient healthcare professional relationship. That's what we want. We want to make a change in the medical industry so that you can have these conversations with a prepared person.
I was wondering what your thoughts are on organic versus non-organic selection of foods. I feel like everybody has a different pocketbook, and therefore sometimes I feel somewhat depleted in not being able to always purchase organic, and wondering if, I feel like, wow, I'm just filling myself with bad stuff, even though it's vegetables.
I'll mention it briefly, and then I'll pass it on to Dr. Stancic. But when you eat animal products and processed foods, you have the most opportunity to garner all the pesticides and all the pollutants, because those products have had a long time to, those animals have had a long time to store them in their bodies. The plant foods, even though they are many of them conventional, haven't had that much time to really store the pollutants in them. So you're better off just moving towards plants and then towards organic plants, but make the moves in that direction. That's my call.
I couldn't agree more. Yeah. I think although the question is important, it's secondary. Right now we're eating primarily the American diet is primarily animal sources of food and processed food. 12% of our calories are coming from plant-based foods. And actually, if you look at that, if you drill down and look at the specifics of that, 6% of that 12% is like apples in an apple pie. So it doesn't, right? So really only 6% of the calories that we're consuming are actually whole food, plant-based foods. So that's really the first hurdle, and then we can start talking about, organic versus, but obviously in a perfect world, we want organic vegetation, and we can help move that further by purchasing those foods so that, the power of the purse, when we don't buy certain things, then the store keep is gonna change the way that they produce.
While you get the microphone, once you have staples in your kitchen, there are plenty of studies that show that $35 a week is enough for you to have fresh fruits and vegetables for a week, for an adult. So we're not talking about hugely expensive. Plus there are many, many more organic gardens cropping up in communities. Connect yourself to them. There's one right here.
You took me to your garden here.
That's right. It's one of the Reservoir Park Community Garden is featured on this film.
Yeah.
We have time for one more.
Okay.
Hi.
Hey.
Do you know how a healthy plant-based diet or lifestyle can help with mental illnesses? Because I got diagnosed with anxiety about a year ago, and I was scared to take a pill every day. And I am taking it now, but I remember one of my cousins was telling me to take just different types of almonds and fruits, and I don't know. So
Even though we read a disclaimer at the beginning, the side effects of adopting a clean, healthier, plant-based diet are that you might be less stressed, less anxious, less depressed, live longer, be more alert, sleep better. So I say go for it.
Thank you.
Thank you. Thank you so much for the gift of your film and your work in the community. We're very grateful that you were able to join us personally for a very important conversation. And thank you all for coming.
Thank you to the Colonial. Thank you.